So in college, that was my kind of basis. I did training with the soccer team, the basketball teams, and then I went on to get an EMT. And then after you get your EMT, you work for 6 months, you go back to paramedic school, you become a paramedic, and now I'm in nursing school. Slowly going up the ladder. I've worked as a medic since 2008. I've been an EMT since 2006. And now I work at Los Robles in the ER as an ER tech. And I also work on the ambulance still as a paramedic. So we do all in the field, we do all kinds of things. We do 911, we do standbys. We have the Staples Center. So if you guys watch the Kings, any Kings fans here, we have 2 of our medics. We're on the ice. They're there. We have medics at Staples Center for Lakers, the Clippers, and the Kings, just for the players, and they get to watch the game. So it can be a fun job. And then at the hospital, I do all kinds of stuff in the ER, help the doctors, help the surgeons, help the nurses, kind of like a jack of all trades. So what's cool about the hospital is I get to see a ton of stuff, because on the ambulance you get 4 or 5 patients a day. The hospital we see anywhere between 130 and 150 patients. And we're a trauma center, we're a heart attack center, we're a stroke center. So we get everything from East County. So Camarillo all the way to Simi Valley, and then parts of Boston. So if you guys call 911, you guys can come to Los Robles. So that's what I do. I want to make this kind of interactive. Last time I did this, I was kind of taught a little too much. I want to kind of interact, so you guys get the concepts of what you're learning, the why, and so you actually remember it. So they say you remember 10% of what you hear, so I want you to remember 10% you remember. It's actually useful information. So, let's start with CPR. You guys are going to do CPR today. What do you guys know about CPR? What are we doing when we do CPR? Okay, good. So, you can breathe for them. What else are we doing? We're getting their heart going again. So, we're doing 2 things. When you're in cardiac arrest, your heart is stopped. When your heart is stopped, you're not breathing as well. You can be not breathing and still have your heart going, but you can't not have your heart going and still be breathing. So when you're in cardiac arrest, there's no heartbeat, no breathing. So the old way was we breathe and we do compressions. There's this new thing called compressional and CPR for leg biceps. So what they found is that people that go down, people aren't doing anything because they're afraid to do mouth-to-mouth. For good reason. I wouldn't want to put my mouth on somebody else's mouth either. So what they want you to do now is just do compressions. So you guys know how long the brain can survive without oxygen? 10 minutes. Okay, so every minute, 10% you lose. So every minute your heart's not beating, you're starting to lose brain tissue. So they say time is muscle, time is brain. So what are we doing when we're doing compressions? What are we doing? What are we acting? We're doing the heart. Okay? So really good compressions, you get about 20% of what the heart can do on its own, but it's enough to perfuse the brain. And so, have you guys started CPR at all? Not at all. You know your compression rate? How fast are you supposed to get up?
I'm supposed to be around 30 per minute.
100 per minute. Yeah. So you're doing cycles of 30 to 2. So there's a lot of numbers involved, but 100 per minute. So what we do is we teach CPR to Staying Alive, the song by the Bee Gees. Have you guys heard that? Okay, so that's 100 beats a minute. So if you can think of that in your head, you can go at the right pace. It's about that fast, right? When you do CPR, if it's an old person, you might feel the ribs crack a little bit. That's normal. And then another thing that people are afraid of, they're afraid of doing CPR on somebody whose heart is actually beating. But if you can't feel a pulse and they're not breathing, you're not going to hurt them by doing CPR. They might be a little sore in the ribs, but it's better to do CPR and help the heart than to not do CPR and then have the patient die. So don't be afraid to do CPR. A lot of times people that overdose on heroin, their buddies are not very smart as well. They'll do CPR on the patient. They're still alive, so we go and people get CPR done all the time. And they're alive and they're fine, so don't worry about it. And the new guidelines, when we do CPR, we shock them, continue CPR. So even shock resets the heart, and the heart starts beating. We're going to help the heart by doing CPR. So it's wounded, so it needs a little helping. So don't be afraid to do CPR on people. So what does an AED do? Does anybody know? Shocks the heart.
Well, like, put a few pads on and then it gets the current going through the heart to the muscles to keep reacting, even though the brain might not be as strong.
So it does send electricity through, but what does it do? Does it restart the heart or does it reset the heart?
Resets.
Resets, okay. So what's happening when you have cardiac arrest is the heart is either doing two things. It's either beating so fast that it's not beating efficiently. It's like if you hyperventilate really, really fast, you're moving a tiny bit of air, but you're not getting enough air into the lungs. Eventually you'll pass out. So it's either doing that or it's quivering. The whole thing's just quivering, and so it's not working. So when we put on an AED, it's looking for those two rhythms that you can see, and it'll shock the heart. And what it does is it resets the heart, and the sinus node, which is like the conductor for the heart, will then hopefully take back over and give a heart rate back. It's actually confusing. So that's what an AED does. So an AED, when it analyzes it, will either say shock advised or no shock advised. And that's based on what the AED, the rhythm that the AED sees. So I just want you guys to know what's going on. And got it clear. They've done some studies where they did CPR while they were shocking. I don't know what the results of the studies were, but we don't do that at the hospital, so just make sure you're clear when shock happens. If the pads aren't on real tight, you get a little bit of a zinger. It's happened to a couple of our nurses, and they're fine. It's not. So, that's CPR. So they, in Ventura County, are the save rate. What do you think of save? People that go down to CPR, what do you think? Paramedics come, what do you think their survival rate is? Percentage-wise? 75. What else? Yeah, 50? 65. So across the nation, it's about 10%. So it's really low. But what they've done is with the sidewalk CPR is what they're calling it, the compression-only CPR. Bystander CPR is the most important factor of survivability. So if you're there and you can do CPR, you're like exponentially increasing the chances that that person will survive. So in this county, I think we're up to about 15%, which is across the nation, that's pretty huge. So, and then at the hospital, we have a post-cardiac arrest survival group for people that have survived cardiac arrest. There's probably 15 people that come and meet once a month and just kind of talk about what it's like to die and come back. So one of our paramedics had that happen. They brought him in, and he's still working as a paramedic. So CPR works. You can do it. So. All right, so let's get on to first aid. So let's start with burns. All right, what can you tell me about burns? What are the different classes of burns?
First, second, and third degree.
Okay.
Third degree being the harshest.
Correct. All right, so who here's had a burn? Everybody. Who's had a sunburn? Okay, that's a first degree burn. It's mild. So what differentiates first degree from second degree? You know, something will show up on the skin.
Bosses, wait, something that shows up. I was going to say bosses.
Blisters. Good. So that's what separates first degree from second degree. If you get blisters, that's a second degree burn. And then third degree burn goes down past the skin into the muscle tissue. So first degree burns are pretty common, not normally a big deal. Second degree burns, depending on how big they are, can be a big deal. And then third degree burns are always a big deal. So why are burns a big deal? What happens to the skin? What does the skin do for us? Skin's the largest organ in the body. What does the skin do for us?
It keeps blood and muscle structure inside the body.
Okay, good. So, okay.
Oh, and it protects like the rest of the body.
Good. So it protects us from sources of infection. What else does it do? It regulates something. Body temperature. Good. So with burns, what we're worried about is if you have a large surface area burn, you lose the ability to control your body temperature. So we have to worry about keeping the patient warm. And also, if you get a cut or something, it always seeps fluid, so you lose a lot of fluid and have a large surface area to burn. These are normally second and third degree burns. And so for burn care, what do we do if we get a burn? Sunburn, aloe vera, no brainer, but what happens if we get burned at home or something like that? Cold water. Okay. So what are some sources of burns that we have? Oven, okay. So that's a thermal burn. What are some other types of burns that are? Fire. Hair. So girls, we get a lot of curling iron burns that come into the ER. They get, 6-degree burns on their fingers and stuff. So be careful with your curling irons.
Well, does this count chemical burns?
Chemical burns, good. So a lot of chemicals can cause burns. Ice can actually cause burns. Yeah, dry ice. And then what else? There's another type of burn. Be surprised if you tell. It's electrical burns. So people that get electrocuted with the high voltage stuff, it actually burns as it goes through. So a lot of times there's an entrance and an exit point. So you'll see third-degree burns on the entrance, but then where the electricity travels also burns. We have burns actually on the inside of the knees. So a lot of electrical burns actually go to the burns.
Like people with like when they get electrocuted,
Yeah.
usually they have blue, or not blue, I guess. But there's a blue hole on their arms and whatnot, or across their body, they have like it's dark because of sleep.
Right.
So it's usually.
So that's from the burn.
Yeah.
So burns, cold water right away. How long do we want to do it? No? 20 seconds. What do we do till the burning kind of goes away? Sometimes they say 20 minutes. So most things in the medical field are common sense. If you have common sense, you can do okay. Most people, think, oh, we're going to go to the doctor, but a lot of things that you do to prevent, injuries and that sort of thing are common sense. So cool water. If it's a second-degree burn and there's blisters, what do you think? You want to pop the blisters? Or you want to keep the blisters intact? Why? Good. So yeah. So we want to worry about infection. So most of the time, keep the blisters intact.
What's in the blisters? Is it blood?
It's not blood. It's just serous fluid. So like your sweat, it's basically the same type of fluid. It's a plasma. That's what I couldn't tell you what's in it. It's probably like my blood cells and that sort of thing. Blood plasma. So as long as it's intact, it's okay. The big blisters, if they pop, a lot of times you will cut them off because you don't want to leave an area that if it goes in, it's trapped in there, and then we'll just put the dressings on it. So what do you not want to put on bad burns? Butter. Salt. Basically, if you're going to come to the ER, don't put anything on it because we're gonna have to clean whatever you put on it off. Just you can put some wet, like a wet towel on it, and then come into the ER. What we'll do is we'll put wet dressings on it. Sometimes we'll put antibiotic ointment on it when you leave, or we have this really cool dressing called Silvadine, which has silver in it. Silver is actually an antibiotic, natural antibiotic, and that stuff works really well. But if we're going to send to the burn center, if it's really a really bad burn, then we go to the burn center, which is in Woodland Hills and West Hills. We won't put anything on either because they're going to have to clean it off to see the burn when it gets there. So, if you can put anything, put antibiotic ointment on it. Otherwise, just a wet dressing and come into the ER. So, that's burns. All right, what do we got next? Heat illness. All right. So, what's the difference between heat stroke and heat exhaustion? Any ideas?
Heat exhaustion means that you just get tired of the heat, and then heat stroke when you pass out.
Right. So, heat stroke is a true medical emergency. Heat exhaustion is temperatures up to 104. Anything above 104 is defined as heat stroke. And in heat stroke, you stop sweating. So why is it a problem if we stop sweating?
Don't let off heat.
Right, so you're not cooling yourself off anymore. And so your body temperature is going to rise. So what do we do for somebody that has heat exhaustion? Drink water. Okay, what else? Pour water on them. Good. So pour cool water, not freezing cold water, but just cool water. What are some other things we can do? Good. Yeah, so shade is good. Keep them inside in the air conditioning. So common sense things, right? Give them water, cool them down. pretty simple. Most I know illnesses can be prevented by just a little common sense. All right. So what's the problem with heat stroke and heat exhaustion? What's the problem? And here it's really dry. What happens when you go to Alabama down south where the humidity is really high? What makes that different than here? Okay. So why is that a problem if there's more moisture in the air? So what are different ways that we can get rid of heat in the body? There's different sweat, okay. So what's the technical term for sweat, for water going off of the skin? Perspiration is the name for sweat. That's evaporation. Okay. So there's different ways for heat transfer. There's conduction, which is touching. You can feel cold desk, really. Evaporation is water coming off. So the air humidity is 100%. There's nowhere for that water to go. Remember, everything happens with diffusion. Remember, what's diffusion? From higher to lower concentration. So, good. So we're all working together to get this. When it's 100% humidity, it's the highest concentration. So water on your skin is not going to go anywhere because there's no diffusion happening. So that's why when you go to a high humidity place, you lose one of your cooling mechanisms. Right? So, the other thing for heat stroke, normally they're going to be confused. They could be completely altered, not know where they are, not know who they are. That's a medical emergency. So that's going to require IV fluids to rehydrate. Put ice packs on them, do fluids, regulate the temperature down. Hypothermia. So what do I do for hypothermia? What can cause hypothermia? Too much cold. So can you get hypothermia when the air temperature is 90 degrees? No. Probably 30. Right. Okay. So you go to the beach. Now I don't know what the water temperature is now, but is it nice? Okay. So it was like a couple of weeks ago. It was like 52. I went in there and I'm not my breath away, but it was 85 degrees out. So if you stay in there long enough, you can get hypothermia. So what do we do for hypothermia? Come on, how do we do that? Okay, water good. Jump in the spot. That's another way we can warm the spot. Deep bags? Blankets. Good. So if you're in a cold environment and you have wet clothes on, what do you need to do with the clothes? Drop the clothes because evaporation is going to take more heat up. Good. See? Simple, right? All right, bites. What kind of insects and dangerous critters do we have here?
Spiders.
Snakes. Spiders and snakes. Scorpions. All right, so what do we do for snake bites?
Depending on where the bite is, you bind it up to keep the blood predominant in that spot so it keeps the venom from flying really fast.
Well, don't you not want to do trinkets because then you can lose the line?
Right, so there's two types of snakes. Here we have rattlesnakes. They have a hemotoxic venom. So what does that mean? What's hemo stand for? Blood. Good. So it's toxic to the blood. So the other type of venom is a neurotoxic venom. So rattlesnakes here. If you get bitten, are you always envenomated? No. So it depends. When they strike humans, a lot of times they don't see us as a food source, so they're just striking kind of as a defense mechanism. They don't want to waste their venom. So a lot of bites that we get here are actually dry bites, so they don't actually inject venom. When people stick their hands in the bushes and there's a snake in there, that's a lot of times when you get an injection with the venom because they think, oh, there's a little small animal or something like that, and they try to kill it. So with rattlesnakes, hemotoxic venom, we don't want to do tourniquets on that one because what we want to do, you can't suck out the blood. So the poison actually attaches to the blood, so sucking out the blood is not going to do anything, it's already in. So what we do, if you do get bit by a snake, you want to come to the ER. A lot of times you can't tell if it's a dry bite or a wet neurotoxics can affect your respiratory system. So in Australia, where they have some really gnarly snakes, they get bit. What happens is it drops their respiratory drive and they stop breathing and die. So those, if you tourniquet, you can actually trap the poison in the arm as it gets to your respiratory system, and then you can get somewhere where they can then breathe for you. Or if you have an ibuprofen pump, you can then breathe for you. Just like CPR, we have the same capability. So it just depends on what it is. But here, we don't do tourniquets.
So there's no neurotoxic snakes around here?
Not native. However, people have snakes at home that can't be. So it's a possibility is there. So, but a lot of times you're not going to know what kind of poison it has. So best thing is
Are those snakes legal to bring into the snakes? Because I know California has a lot of laws as far as.
I don't know. People have stuff that's not legal all the time. So, coral snakes, you can find them in Florida, native in Florida. Have a neurotoxic venom. So I don't know what those state laws are. People do things that are legal all the time. So. And then, let's see, what about spiders? What kind of spiders do we have under that? Black widow.
Brown recluse?
So brown recluse, they actually live in California. No. So I had a nurse practitioner tell me, no, they don't live there. Are you sure? So I looked it up. They're actually on the other side of the Rockies. So the only time brown recluse come over is if they come over on a box or something like that. So they're actually really rare. Most people that think they got bit by brown recluse have what's called a staph infection. And it causes the same sort of infection in the arm of the brown recluse. It can be like an necrotizing bacteria that basically kills all the cells. So normally it's a staph infection, but people think it's a brown recluse just because I thought it was too. So, black widow bites come into the ER for that. A lot of times allergic reaction is the biggest threat you face, but actually they're really painful. I haven't actually seen it.
Wait, did you say that snake can cause staph infections, or like people think? What'd you say about that?
So the brown recluse is not found native in California or anywhere near here. So a lot of times people think they got, they'll come in and be like, oh, I probably got bit by a brown recluse at night while they're sleeping or something like that.
Oh, okay.
Or they do get bit by a spider, and the spider introduces a bacteria that looks like a brown recluse, but it's really just a staph infection.
Okay.
So the staph is a type of bacteria, it's a shape of bacteria. So that stuff's not going to be on the test for us, it's just kind of interesting information. So, and then scorpions. So we used to do a houseboat trip to Lake Mead, Calvary Community Church in the high school group. And we had a girl that didn't see it, but she felt something prickling on her arm, and it stung her twice. So it was a scorpion, so like a tiny little scorpion, but it has a neurotoxic venom in it. So she started to feel numbness and tingling in all her extremities. She started drooling, so we took her to the ER. She was totally fine, but they had to watch her airways. That's all. We just want to make sure she continued to breathe, make sure she didn't have allergic reactions. So we do have scorpions in California. I think we have the same type. I think they're the bark scorpions. There's different types of scorpions, so just be aware. And then jellyfish and stingrays. So what do we do for jellyfish?
Pee on it.
Pee on it. So what does the peeing do? No idea. So for jellyfish, the peeing is the acid. I think kills whatever the stingers have, it breaks up the acid. For stingrays, you put hot water on it, and that neutralizes the acid. So if you get stung by a jellyfish, go to the lifeguard. Or you can pee on it. Oh, you got stung by a jellyfish? Or was it? There are some jellyfish that can kill you. You're SOL. Alright. Oh, other bites. What kind of pets do we have at home?
Dogs.
Dogs. What's the other pet we have? Cats. Okay. So what happens if you get bit by one of them? For the ear. Puncture wounds, they have a bacteria on their teeth. Normally dogs, when they bite, it kind of tears the skin open a little bit more, and the bacteria can come out, and so it's not a problem. Cats, they have sharp little teeth. When they bite, it pushes the bacteria deep into the skin, and you can get a pretty bad infection. dogs and cats have the same bacteria, but the bites are different. So dogs don't really cause problems. We've had chihuahuas with bites. And what ends up happening is you get an infection and you get redness. You start to see redness and swelling going up the arm. That's a big deal, and you can the ear. So if you ever see a little localized redness, not a big deal. It's starting to travel up the arm and you're getting a lot more pain. It's a big deal. You're going to get many antibiotics. So just be aware. And then brothers and sisters like to bite too. Humans have bacteria in their mouth too. That's bad. So what do we do with cuts and bites and stuff like that? How do we clean them? Hydrogen peroxide. So actually, all you really need is soap and water. So soap and water they found to be just as effective as hydrogen peroxide. For the puncture ones, you use hydrogen peroxide so we can help get the bacteria out. But soap and water works just as well for cleaning. So cuts, just make sure you clean when you get cuts like that. So you can prevent infections just by cleaning really well. Soap and water, take a shower, scrub it down. A little painful, but a little pain now is better than a lot of pain later. If you come to see me in the ER, I'm going to scrub you over with a toothbrush. I'll take care of her right away. Alright, we're going to seizures. So seizures are really scary for a lot of people. They don't know what to do, but in reality, all you have to do is just make sure they don't hurt themselves while they're seizing. Don't stick things in their mouth. Don't stick your finger in their mouth. You'll probably find it. But most people have a seizure disorder. The seizure will stop on its own. This will last between 30 seconds to a minute. It just is really scary. So you lay them down on the ground, clear an area away from them, and just kind of hold their heads. Or anyone, obviously. But seizures are not that big a deal. What is there you can do for a seizure? Nothing. So there's nothing you can do. There's nothing you need to worry about. So you just kind of protect them a little bit. That's all you can do, and that's the treatment for it. That's what we would do too. If somebody sees in the back of our ambulance, we're going to turn them on their side and have them see. Just let them seize. Most times they'll run out. If they keep seizing, we'll give them medications to stop the seizure. But in general, the treatment that we're going to do is the same treatment that we use. So we can monitor their airway better, obviously, by the medications. But a seizure that lasts a minute for most people is not a big deal. If they fall and hit their head and have a seizure, it's a little different. But if it's just a regular seizure, they have a seizure disorder, they'll need to go to the ER and get the levels checked. It seems scary, but it really isn't. You guys have any questions so far? Alright, what's a stroke?
Blood in the brain?
Blood in the brain? Okay.
Like some vessel pops.
Good. So you can have a bleed in the brain. There's another type of stroke too. There's two types.
Where blood doesn't get to the brain.
So either you have bleeding in the brain or you have a clot in the brain. There's two types, and there's no way to tell the difference unless you get a CT scan. So the treatment for stroke is get them to the hospital quickly, so that we can then get them to the CT scan. We can see what's going on in the brain, and then we can treat them appropriately. So how do you tell somebody's having a stroke? What are some symptoms that they're going to have? Memory loss, slurred speech, good. That's a big one.
One of these is still
So there's an acronym. You want to write this down. This will be on the test. So it's FAST is your acronym. FAST. So F stands for facial droop. I worked last night. Oh, arm. Okay, arm drift. So we usually have them stick their hands out like this and close their eyes. If they're having a stroke, one of their arms may drop. That's a positive sign. So we're looking for facial droop. When they smile, one side will go up, the other side will just limp, be kind of limp like that. For arm drift, slurred speech. So any of those three things, let's call 911. And then the T stands for time. So it's just a reminder that time is brain. We want to get them there as fast as we can. So when the paramedics show up, they're going to do the same thing. They're going to check smile, slurred speech, arm drift. If any of those are positive, they're going to call the hospital and let the hospital know they're bringing in a stroke. We're going to get a neurologist, we're going to call them. So everybody will be there and waiting, so when they get there, we can take them straight to CT, and it makes everything run really quick. So if you think somebody's having a stroke, call 911. It's really important. So it's fast. Everybody get that? Face, arm, speech, time. That'll probably be everything. All right. What's a heart attack? What's this? You got this. Okay. Clogged arteries. Right. So when an artery pops, that's a heart attack. So this is a plaque. This bursts and causes the clotting factors to kind of kick in the heart, and it'll actually cause a little clot. So that's what a heart attack is. And what's the main symptom for a heart attack? Chest pain. Good. So not all chest pain is a heart attack. Chest pain can be a lot of different things, but chest pain can also be a heart attack. And so it's hard to differentiate between what it is. So if somebody's having chest pain, it's not like they just ran into a desk with their leg, or they just got punched in the chest or they have chest pain. Any other reason. But if they just had sudden onset chest pain, that's a good reason to call them. So same thing, chest pain. Paramedics show up, we're going to do an EKG. We can look at the heart and how it's working electrically, and we can tell if yes, they're having a heart attack, or no, they're not having a heart attack right now, but it could be progressing. Come into the ER if they are having a heart attack.
What causes the arteries to block?
Yeah, it's just a plaque, and then as it grows, I think the lining thins. So from hardening in the arteries and then the plaque between the two of them, high blood pressure, if you get stressed, your blood pressure will go higher, that can cause a rupture. So I think there's other things that cause it, but in general, it's definitely a rupture. So they'll call the hospital again, we get a cardiologist to come in, we have to see him, and we take him to the cath lab. In the cath lab, we go in through the femoral artery, and they thread a little balloon up there, and they inject some dye, and they can actually see all the arteries in the heart, and because they know so well, they can see, oh yeah, that artery, it stops right here, we have a blockage, where there's a real thin, it's almost all the way blocked. And so they're going with the balloon, and they take the balloon and inflate it, actually opens up the clot. And then they can place stents, which are little wire mesh things that actually hold the plaque open. And they have drugs on them that prevent clotting. So it's pretty neat to watch. We have to watch a bunch of movies to see once they open it and they inject the dye, you can see the heart refuses. The patients will wait during the procedure and they'll say, oh, my pain's coming. So it's really neat thing to do. And we can do it. It's not, they sedate them a little bit, they're not just the pain. But it's really cool because a lot of times within 60 minutes of them getting into the hospital, we can have the artery. So it's pretty cool. It runs pretty fast. So that's why we like to call 911 for chest pains, is because they can then notify us that they're coming in, they have everything done, they have the IV and they have the meds going. And so it just speeds up the process. Alright, so you guys are going over drugs. Tell me about drugs.
They're bad for you.
They're bad for you. Why are they bad for you?
They affect your health.
How do they affect your health?
Like, I mean, it depends on what
Most
of
of
it straight to your, most of it is
Okay.
which affects your heart and everything.
So what are some problems with drugs?
Those brain cells.
Those brain cells? Alright.
And
Destroys organs? Good. What was that? Affects your respiratory?
It causes like an impaired reaction time and concentration.
Very good. Can cause cancer. So, different types of drugs do different things. There's uppers and downers. Uppers are like cocaine, methamphetamine, bath salts. They raise your blood pressure, they raise your heart rate, you can get a heart attack from them, you can get a stroke from them. They really mess you up. The downers, heroin, alcohol, that sort of thing, narcotics, they can affect your respiratory tract. So last night we had a guy come in, he was completely out of it, he did anesthesia, nothing. The guy was just spitting up, just like dead to the world. He could have done anything, throw him off a bridge, he wouldn't know. Ended up he had So you got the full treatment. You got a catheter up into the bladder. You got an IV. He almost got intubated, so we almost stuck the tube down his throat. Like this, it's all because he took drugs. So we've had people come in that are dead because of that. They, their friends see, hey, the guy's not doing very well. They throw him in the back of the car. They drive him to the ER. By the time he gets to the ER, he hasn't been breathing for so long. And by the time he gets out, like, there's nothing we can do. See the kids 16, 18, 25. Sometimes we are able to go back, sometimes we aren't. A lot of times they come in by private vehicle. There's a lot of times nothing we can do. They end up needing donors or organs. So drugs are really dangerous. And what's even worse are combinations of drugs. So, you might be fine if you take a narcotic, but then you mix alcohol with it, and now all of a sudden you're not breathing. So, you guys have read about all the problems with them. There's long-term effects, there's short-term effects. Ecstasy is one of those ones people do it at raves. What are they doing at raves? They dance all night long. Well, ecstasy decreases your cerebral spinal fluid. So the cushion that your brain has is now decreased. So what are you doing when you're rocking your head all night long? You're banging. So you're doing like micro concussions for like 3 hours. These people, they wake up in the next morning, they get a severe headache, they can't think straight. And drugs, when they go into the receptors, it changes how the brain reacts to drugs. So, people get addicted to drugs, they need more and more. It's because the brain actually reacts and says, hey, this amount is not enough. Or, hey, you're not giving this to me, I'm going to revolt. So we had a lady in there last night she was on pain meds, and she hadn't gotten any, so she was withdrawing from pain meds. So she was real twitchy, she couldn't follow directions. So there's, drugs, they sound cool, but every drug has an effect. Tylenol has an effect, ibuprofen has an effect. So, even the so-called safe drugs you can get over the counter, everything has side effects. So you just have to be aware of those and use them appropriately. Ibuprofen can kill your kidneys, Tylenol can kill your liver, so there's just, there's risks with everything. So that's why they have all the warnings on the stuff. You guys have any questions on drugs? Make sure you have a test. Reminder right on the answer.
Wait, is marijuana in England or is it not?
I think it has its own category.
It does.
Does it?
Fits like 5 of them. Like, it's not anymore.
There is a lot of overlap on drugs as far as what they do in categories and that sort of thing. Yeah, another story. My good friend I grew up with overdosed on heroin and he had a full-ride scholarship to D1 school for baseball. He could throw a 98-mile-an-hour fastball, and now he can barely walk or talk. So he ruined his life by doing drugs. Stuck with it. So it's just and that was one where I said at a party, a friend saw his mouth, he wasn't breathing, so they ended up taking him out through a window and having him go out the front and driving him in and dropping him off at the hospital. Just he'd been not breathing for so long, he had so much brain damage that he had to learn how to walk. Couldn't walk at first, but he did like 3 months of rehab, but he'll never be the same. So his life is totally ruined. Alright, so watch the video. Skateboarder, what do you do if you see something like that happen? Was that cringe? Yes, you do.
We're not in hospital today.
Okay, so what if they're unconscious?
Usually someone panics. Check for breathing.
Check for pulse. So if they have a pulse and they're breathing, what do we want to do?
Then check over if there's a bone, if there's a common fracture.
Do we want to move this person?
Usually not.
No.
Could be their neck or something.
So that guy broke
everything.
Right, yeah. He ended up breaking, I think, a couple of ribs. He was really, really, really lucky. He fell, I think, 40 or 50 feet on the wood. And they ended up, if we continued watching, he ended up walking off the skateboard ramp, which is, I've been the medics came out, obviously, but they should not have walked them off. But sports stars are really stubborn in there, you know, they have this, he-man complex, and they're not going off on the back foot. So. They were lucky, he was lucky, because he easily could have had a spinal cord injury or fracture that could have turned into an injury. Yeah, you could have any possibilities for him are endless. So, we had a kid yesterday or 2 days ago come in, skateboarding, fell, broke his hip. Shattered in about 6 places. He's going to have to learn how to walk in, have a couple surgeries, he's going to be out for a while. So they're dangerous. So with that, really important, wear helmets. Motorcycling, bicycling, really important to wear helmets. Skateboarding, wear helmets. And then snowboarding, that sort of thing too. If you're doing any kind of tricks, that sort of thing, you gotta wear helmets. We have, we don't see a lot of people because they were wearing helmets, but we do see people that weren't wearing helmets. And like about 3 months ago, we had a 14-year-old come in riding his bike, got hit by a car, and he was not wearing a helmet, and he ended up dying within 2 hours of getting there. But the rest of his body was fine. He took all the damage in his head, just by the way that he hit the car. I don't know if he would have survived with the helmet, but his odds of surviving would have been extremely much better if he had a helmet on. So I can't stress the importance of wearing a helmet. We had motorcyclists come in, he was riding, and he fell over with his girlfriend on back, and he landed on his chest, but he had a full face helmet, and the helmet was just gouged all the way down. If he hadn't had a full face helmet, he would have been really, really messed up. But he just had some abrasions on the back, and we cleaned up together to walk home because he had the right protective gear on. So wearing helmets really, really important. The body can heal really well, the brain doesn't do well with injuries. But
I've seen people that ride motorcycles, they wear in the street, they wear like a certain thing. It has like these hard pads with their heels, their toes, so if they fall, they kind of slide.
right. So motorcycling, if you slide, it's all a force thing. If you can lengthen the amount of time that your force is distributed against the body, you'll do okay. So a lot of times the problems with motorcycles is they get hit by cars, or they run into curbs, or other solid objects like fire hydrants, and that's bad. But if you're on a motorcycle and you have the proper riding gear on, they may have a broken wrist or broken arm or something like that, but their skin's intact and they'll be able to see these guys wearing a t-shirt and shorts and they come in and they just have the gnarliest road rash I've ever seen in my life. They have to go to the burn center for skin grafts because they lost too much skin. You have to scrub them, and it's not fun for us to scrub them, and it's not fun for them to get scrubbed. So wear protective clothing. So if you see something like that, don't move them. If you see somebody, let us come. We're trained to move people like that. We have the equipment to move them. The only time you would ever move somebody like that is if they're in imminent danger, like they're in a car that was on fire, and if you left them there, they went to burn. So if their life's in danger, then move them, yes, because life's more important than walking. And generally, when we move them. There's a kid that was hit here probably 5 years ago by a car, flew 40 feet. His shoes stayed in the exact spot that he was hit. He flew, and they ended up finding him. So he was fine. He was really lucky. So, right, so what do we do with bleeding? How do we stop? Pressure. Good. So common sense. Put pressure on bleeding and it'll stop. All bleeding stops eventually. Either run out of blood or you stop the bleeding. So last time we had a lady come in, she had an arterial bleed in the head, and so we had to put pressure and we sutured it to stop the bleeding, but she bled quite a bit. So heads bleed a lot. It's totally normal to have a ton of blood in the head. Just pressure, pressure, pressure. Leave it on there. You can't does it stop now? Stop. Every time you do that, you're pulling the clot off. It's going to start bleeding again. So if you're going to put pressure on there, put it on for like 10 minutes and then it'll stop. So for sprains, what do we do for sprains? Everybody rolls their ankle at some point in time. Nice. Elevation.
Change the alphabet.
Was it?
Change the alphabet.
Trace the elevation. So do some. Are you an athletic trainer? No. So RICE is your acronym for this. So this will probably be on the test. So rest is the R. I, ice.
Right.
C is compression. How do we do compression?
Wrapped.
What do we wrap it with?
What do you call it? Oh my gosh. That soft stretchy thing.
Ace band.
There it is.
There we go. So wrap it, not too tight, but just snug. You should be able to get your finger underneath there. Your toes shouldn't turn blue or numb or cold or tingly. It's too tight otherwise. And then elevation. We want to help decrease the blood pressure in the limb and help swelling. So that's a big one. And then, all right. So I got some stuff here. This is my first aid kit that I take hiking with me all the time. It's probably more than you would need in general, but I know how to use a bunch of stuff in here that we can use when I need it. So this is small and convenient. I went on a 7-day backpacking trip. This is what I took with me, so I can treat anything from a really bad bleed to anything. But when you go hiking, you should take at least something like Band-Aids, something simple like that, maybe a little gauze, maybe some gloves. So I don't like touching bloody stuff, so I keep a pair of gloves on. You can do a lot with a pair of gloves. And then, Altoids container, I have Band-Aids in here. And then I have super glue. Super glue is really cool. So I keep a little bottle with me at work. At work, we have to wash our hands like 50 times, 60 times a day. So if you have cuts on your hands, it's annoying. So I put super glue over the cuts. As long as you clean the cut really well before you dry it, before you put the super glue on, most of the time it's totally fine. So we have surgical glue at the hospital, but I'd rather use this. It's actually easier and it's quicker. And it costs way less than surgical glue. So super glue should be in every first aid kit as far as I'm concerned. So use it for long cuts, circular cuts, like whatever, you can put it over and it seals it and makes it look protected. It seems weird, huh? But it works. I do it all the time. It'll just fall off. So your skin naturally grows in under and it'll just exfoliate. When you get it under. Yeah, don't stick your fingers together when you do it. And then tape works really well for blisters. It's just good to have. Silk tape works well. You can probably buy this at the athletic tape. Buy it at all the store. So EpiPens. This is a demo. These things can be confusing. Red normally means danger, so that's probably the business end, and this is the safe end. When you do an EpiPen, so what are we using an EpiPen for? Allergic reactions. So I drink, there's a certain type of energy drink that I drink that I get an allergic reaction. Do I need an EpiPen for that? It might get a little bit of hives. Okay, so what are we using EpiPen?
It's like anaphylaxis shock.
Anaphylaxis is what it is. So, if they have shortness of breath, chest pain, you feel like their throat is closing, that's when you use this. So the way to use it, you take the 2 caps off, and you always hold it like this. You never hold it like this. Why do we not hold it like this? So nothing comes out of the back. So what happens if you accidentally go like this? And then you go to do it. What happens? That really big needle goes into your finger, and it puts medication you don't want in your finger, and the medication you want in the other person is now gone. So never put your thumb over the end. We had a nurse at a school do that when they come in. Epi is a vasoconstrictor, and so if you put it in your thumb, it's going to turn your thumb blue, it's going to cut off the circulation. So always hold it like that. You don't have to slam it, it's not like the movies. Just make sure it's pouch. Just literally press it right in the upper thigh right there, just like that. It'll go through jeans, and you hold it for 10 seconds. So when you press it like that, the needle automatically shoots out, and then it injects the medication in. But it takes about 10 seconds to get all the medication in, so you have to hold it. So you just leave it like that, and then when 10 seconds, when you pull it out, there's going to be a needle in there, so you got to be careful with the needle. If there's dirt, just stick it in the dirt, grab it next to the dirt. should have them there. But, they're big. And it comes out with force. I've seen one demonstrated, they did it through cardboard, and it just shot right through the cardboard for the medication shot. But so why do we need to call 911 with this? Even if we use this, why do we need to call 911?
In case it doesn't work.
It doesn't work. Most people aren't allergic to Epi. Epi is naturally occurring substance, but it only lasts about 5 minutes. So if you're having a severe anaphylactic reaction, you give it, this will save your lives for a little while, but then this is going to wear off and you need more. So paramedics carry epinephrine, they carry Benadryl, they have histamine, and they can give it alcohol. So really important. If you're allergic or you're hiking with somebody that's allergic, they need to have this with them. Because if you get, you're out in the woods and they get stung by a bee and they're really allergic, there's nothing you can do for them. They could die of it right there. So you need to carry this. Questions? So don't put the thumb on it. Alright, this is just a little demo. This is an ET tube, endotracheal tube. And so, typically your head anatomy. So this goes down into the, there's 2 tubes in the throat. One goes to the stomach, one goes to the lungs. Everybody know the name one goes to the lungs? Trachea? Trachea, good. So this goes in through the vocal cords into the trachea. This little balloon gets inflated. That's about actually how much inflated it would be. And it seals off the airway. And then your bag valve mask, which you guys have bag valve mask? Yeah, it's a big thing. Puts right on here and breathe. I did this last time. I didn't do this, but I did the breathing for somebody last night. So, they're really cool. And then if they throw up or anything like that, this seals off the airways. One of the other problems with getting intoxicated drunk is you lose your gag reflex. And when you do, you've had a party, you eat food, drinking alcohol in your stomach's like I'm over this alcohol in my stomach, throw up. You can't protect your airway when you're passed out cold. So you end up aspirating or taking some of that food and the alcohol into your lungs. And the lungs they don't like that stuff. So you can get an infection and it can kill you too. So we put these in because then if they throw up or it's a trauma and they're bleeding in the mouth, it seals that airway off. So we can breathe better and then nothing will go into the lungs. These are really cool. And then one other thing I put in I always hike with one of these. You can use it to put on your head if it's sunny out. You can use it to get water to cool yourself off, or you can use it as pressure bandage. If you get cut or something like that, you can tie it. You've seen it in the movies, they tie. So they're good to have around. Just little things like that. If you're prepared and you go hiking, you have water, you have sunscreen. Sunscreen's really important. And even if you get lost, or what happens if you sprain your ankle and you're 5 miles out, whatever it's all signal. You might have to stay out a little while until someone says, hey, this guy's missing, we need to go find him. So the better prepared you are, that you can survive, and you'll be a lot more comfortable. You can survive in crazy situations, but it just might not be as comfortable as it would be if you have the right preparation. That's pretty much it. You guys have questions? You guys know the difference between an EMT and a paramedic? Paramedic entity. So all paramedics start with EMT. EMTs can do wound care, they can do breathing, they can do backwards. Paramedics, you get into the drugs. So there's 50 drugs that we can use. So IVs and local.
So are firemen like paramedics as well?
Some firemen are paramedics, some firemen are EMTs. So it just depends on what rig they're on and what they're role.
And then some EMTs and firefighters.
Correct. So, is this LA County?
Yeah.
So in LA County, when you call 911, you get it's a BLS, which is 2 EMTs on an ambulance, and then you'll get a squad of firefighters come in, 2 paramedics. And so if it's something serious, then the paramedics will jump in the ambulance with the EMTs and drive to the hospital. If it's something not serious, then the EMTs will just take it to the hospital, and the paramedics will go back out into the system to run another call. Ventura County, every ambulance has a paramedic on it, so you always have a paramedic. So it just depends on which system and